Well, Chapter 9 is about insuring your health, as you can obviously see on the screen. So we'll talk about health insurance this week, or for Chapter 9. The learning goals are right here. We'll go over all of these. Just kind of give you some basics about health insurance, why it's important. How will this affect you? Obviously, a part of a good financial plan is making sure that you have enough health insurance on hand that if you do have some sort of medical emergency, that it does not damage, destroy your financial plan, your savings, things like that. And in fact, medical costs is one of the largest drivers of bankruptcy that we have. So you want to make sure that you have enough insurance to protect yourself from damaging your financial plan and have enough money set aside, of course, to take care of any health needs that come into play in terms of covering your deductibles and co-pays and things like that. And as always, I'll let you guys look at that on your own, the facts and fantasies. So, in the importance of health insurance, I mean, clearly it doesn't take a genius to figure out that health insurance is important. The next best thing to good health is good health insurance. Clearly, maintaining a healthy lifestyle in terms of healthy eating, exercise, maintaining your weight at a healthy level are all things that are, will contribute clearly to good health. That will help you live longer and help you not have to pay as much in health insurance cost down the road also. But we can't control things like major illnesses, accidents, things that that happen beyond our control. So clearly we need to have some kind of insurance for that. So I talked previously about the importance of insurance for many things. And remember that insurance is really the transfer of risk. You are moving risk from yourself to the insurance company. So you're protecting yourself against something bad happening in terms of your health. If it's an accident, an illness, whatever that is, you're making sure that a health insurance company will at least cover a portion of those costs to get better and take care of yourself. About 2/3 of bankruptcies are due to health costs, basically people who just cannot pay their health care costs. They declare bankruptcy to get out from under the bills. About 13% of the number does not have health insurance, but that number is decreasing. And it's decreasing because of the ACA, the Affordable Care Act, which says you have to have insurance, and if you don't, there might be a penalty to pay. So that is driving more coverage, for better or for worse. So, why is health insurance expensive? Clearly, we're paying for advances in medical technology as those new breakthrough technologies are developed. They're very expensive to bring to market. It's expensive machinery for a hospital or doctor's office to purchase, and so they charge a lot. And so insurance companies are forced to cover those things, and they're expensive procedures, expensive tests and whatnot, and so your insurance cost goes up to cover that. The aging of the population, we've got the baby boomer generation, which is my parents' ages. They are retiring now, and even your parents, think about how close are they to retirement. And so quite often it's just the fact that you get to an advanced society like we have in the US, and quite often it's such that people have fewer kids, and so you have an aging population and you don't have as many younger people who are healthier to replace them necessarily when it comes to insurance pools and things like that. Poor demand and supply distribution of healthcare facilities, administrative costs because of all the regulations and red tape that's imposed on healthcare, that just requires so much more compliance cost, and of course insurance fraud also comes into play. This is just an average of premiums for single versus family coverage for a number of years, and you can just see this because it continues to go up year over year. There's lots of types of health insurance plans. Private health insurance plans available to single people or families provide as group health insurance plans for various employers or for purchase by individuals. You have traditional, which is traditional indemnity, which is fee-for-service plans or managed care plans. And you're seeing a lot more trending. There'll always be evolutions in healthcare and healthcare coverage to try to make it more affordable, the best that insurance companies can. So it's always something to keep kind of be aware of once you are on your own and you have health insurance and are paying for it. Just kind of be aware of some of the basics here, so you make informed decisions when it comes to providing for your own health care. So traditional indemnity plans, fee-for-service, typically offer unlimited choice of doctors and hospitals. You can go to any doctor, any hospital, there's no restriction. You pay a deductible plus a percent of eligible costs. So you might pay a deductible for every visit or every procedure, and then a percent on top of that you pay, potentially up to a certain limit typically. Reimbursements based on usual and customary and reasonable charges, what they call UCR, and your healthcare service is separate from your insured. Then you get to managed care plans, which are becoming much more popular. And typically, what you'll probably see is most employers who are offering health insurance are offering some type of a managed care plan. Monthly payments are made directly to organizations that provide health care, such as an HMO, which is a health maintenance organization, or a PPO, which is a preferred provider organization, and others. They designate what doctors and hospitals are within the network. So you have to make sure that if you go to a doctor or a hospital, that it's in your network to get the most coverage that you can. If you go to an out-of-network doctor, you will pay more. Holds down costs by controlling amount of care provided and emphasizing prevention. And then you charge what they call a copayment. So every time you go and have a doctor visit, there might be like a $10 to $20 copayment depending on your plan. It could be even higher depending on what type of doctor you're seeing. And most medical services that are preventative and routine are actually 100% covered. So quite often they include a regular checkup every year, certain preventative tests every year are covered. For if you're a certain age, a colonoscopy is covered every 2 years, and just more maintenance type procedures that are designed to catch the early onset of something bad happening, which means if it catches it earlier, it's cheaper to treat, and your odds of getting better and coming out of that situation are vastly improved. So HMOs and PPOs or something like that are becoming much more popular. So here's the HMO, Health Maintenance Organization. That can include hospitals, physicians, healthcare providers, healthcare clinics. Again, they're providing services for members from a central facility. You have individual practice associations, which is a contract with the physician who operates out of their own office or a community hospital. Then you have the PPO, insurance company or other organization that contracts with a network of physicians and hospitals to provide services for a negotiated amount. The patient can go to providers out of the network, but they pay a higher price. I've already kind of mentioned this one. So, and we're kind of seeing the situation with PPOs playing out in Sioux Falls. We've got two hospital systems, Avera and Sanford. And what Avera went and bought Dakota Care, which was a health insurance organization based out of Sioux Falls, and it covered a lot of South Dakota cities. Well, Avera bought it, and so because they bought that, and Avera already had its own insurance, if you had Dakota Care, you can no longer go to a Sanford doctor or a Sanford clinic. It's not covered anymore. And so Sanford, to counteract that, said same thing with us. We have their own insurance plan, and now you can only go to a Sanford doctor or organization to get your health care, so you can't go to the other ones. So of course that leaves a lot of people kind of high and dry who have developed a long-term relationship with a particular doctor, and all of a sudden, because you've got these changes, they can't go to another doctor now. They have to change doctors. So but that's what a PPO essentially does, is you're contracting within your network, and out of network you may not even cover it, or if you do cover it, it will be at a much higher rate for the person who is getting the service. There are other types of plans out there too. Exclusive provider organizations provide reduced costs and services with affiliated providers. A point of service plan is a hybrid plan from HMO that allows out-of-network services that are paid like an indemnity plan, which is basically a percent of a fee. Blue Cross Blue Shield plans are very, very popular. Actually, that's what I have through USF. They were typically, when they first came out, they were actually prepaid hospital medical plans. They're not anymore. It's just more straight insurance. Many are now for-profit organizations that provide health insurance, like all their insurance companies. But Blue Cross Blue Shield is national. They've got different networks throughout the country. There's one in South Dakota. There's one in pretty much almost every state of the country has some kind of a Blue Cross Blue Shield. Government plans, so once you reach a certain age or certain income limits, you possibly are covered by some kind of a government health insurance plan. Medicare is over 65 or disabled. So when your paycheck, every time you get paid by an employer, that 7.65% of what they call FICA that comes out of your paycheck, a portion of that goes to Medicare and a portion of that goes to Social Security. So that's paying for that. So when you reach 65, then you are under the Medicare because of your age, and you've been paying into that through your lifetime of employment. Some basic hospital coverage is a part of that too. There's different parts of Medicare. So Part A is hospital. Part B is supplementary medical insurance. Both have fees based on your income level and deductible as a part of that too. You can also get Medicare Advantage plans, which is similar to Medicare but provided by private insurers. And Part D of Medicare provides prescription drug coverage, a monthly fee with some kind of deductible. So again, Medicaid is state-run public assistance programs. Typically they're receiving money from the federal government to help fund that. Eligibility is really set by states, and you can see here that 62 million people are covered by that. So states are covering this, but they're getting assistance from the federal government. But the states control a lot of what the rules are, and so it's very state by state. Workers' comp, if you are employed somewhere, you are required to be covered by some kind of insurance that governs if you are injured on the job. Clearly, some jobs have a higher rate of injury potentially than others, but your employer pays for that. It's based on a percent of premiums. Percent of salaries is what it's based on. So, and of course, the more claims you have means the more premiums that the employer may pay. So, an employer that has a lot of accidents will pay a lot more premium. But it covers health care, it covers rehab, and also pays a lump sum for death and certain injuries also. So potentially if you're working construction or any kind of job that requires typically more physical labor, the odds of getting injured potentially are higher than, of course, having an office job. But no matter what the job is, an employer has to pay some sort of workers' compensation insurance. Rationale for healthcare reform. Clearly, healthcare reform has been in the news continuously and constantly. You had the Affordable Care Act get implemented about 8 years ago, about 6 years ago, I think, is when it passed Congress. Then there was a phase-in period, and it's been law for a few years now, where that penalty for not having insurance has come into play for about 3 years now, I believe. But healthcare is a very large cost of the economy. About 17 cents of every dollar spent in the country is spent on healthcare. Outcomes for infant mortality, life expectancy, heart attack survival rates are worse than average for countries who are members of the Organization for Economic Development. Drivers of U.S. expensive healthcare are healthcare costs are deductible for income tax, and providers paid on fees for services, thus encouraging unnecessary services. So just the way our system is set up is kind of just caused some of those expenses to rise. So the Affordable Care Act was to try to reduce the number of uninsured citizens. It also reduced the increase in healthcare costs by providing state-based health insurance exchanges, although you can probably make an argument those have not worked out the way the government thought they would when this law was passed. Many of those exchanges have now closed down because the insurance was just too expensive. So to reach the goals requiring the purchase of health insurance or pay a tax of greater $6.95 or 2.5% of your income in 2016, employers of more than 50 employees are required to provide insurance or pay a penalty. Health insurance sold must provide coverage for 10 listed essential health benefits. Requires health insurance plans providing the following. You have to cover pre-existing conditions. Children must be covered by a parent plan until they reach the age of 26, which is good news for college students, by the way. No lifetime dollar limits on total coverage. Must cover preventative care medical screenings, and companies must spend at least 80% of premiums on claims. And as you add all of these requirements, just keep in mind these are more expensive for health insurance companies to provide, and so to cover their cost, what will they do? They will raise premiums. So all of these things will drive up premiums clearly. Insurance exchanges are available in each state or through the federal government. Not every state went through creating these exchanges, but healthcare.gov is where you'd go to get the federal exchange, which is available in any state. There are 4 levels of coverage, and you can see what they are there. And of course, the higher level the coverage, the more expensive it is to buy that particular plan. If you have meet certain income requirements, typically lower income, the premiums are essentially a portion of them are paid by the government by giving you a tax credit to help you afford those payments. Additional taxes to pay for the plan are 0.9% of salaries over $250,000 and 3.8% net investment income for taxpayers with an AGI, adjusted gross income, above $250,000. Then Cadillac plans are prohibited beginning in 2018. Now, with changes in the political climate, most likely there will be some really big changes to health care, the Affordable Care Act, things like that in the upcoming years. So a lot of what we're talking about here is law now, but don't be surprised if that were to change within the next year or two. So health insurance decisions. So as you are deciding on what health insurance to purchase, evaluating your health care cost risk, consider what your medical care and rehab expenses might be, what the loss of income from disability might be, determine what available coverage and resources are available to you, and then choose a health care plan. So basically think of it like this. If you are injured or sick and become disabled, who's there to help you, right? If you lose your income because you can't work, how devastating is that? Typically, it's not good, right? So you can buy insurance to cover that while you're disabled. You can decide what level of health care coverage you want based on your age, your current health situation, things like that. So you can buy what they call a hospitalization policy. It basically says if you are hospitalized, it will pay you a per day rate to help cover the cost of being in the hospital. So it's very simple. If you have a hospitalization plan and you're in the hospital, they will pay you a fixed amount just because you're there. That's one type of coverage. You can also buy coverage specifically for surgeries. You can also buy policies that deal with certain type of physician expenses. So there's lots of types of policies that you can buy, and these are probably apply more from an individual perspective if you're out there buying insurance on your own and not through your employer. Major medical covers broad coverage for illnesses and catastrophic injuries. So a major med policy would only kick in once you have a certain high dollar amount of out-of-pocket costs. So it's cheaper policy. Typically, maybe if you're younger, you might get that just because your health is typically pretty good. But if you got some kind of an accident or just got some severe illness, it would cover that up to a certain amount once you paid a certain dollar amount out of your own pocket. Comprehensive is really what's probably more popular, especially if you're getting insurance through an employer, where it's covering everything that we just got done talking about. It's covering hospital, surgical, physician, usually pharmacy. Typically you're buying that through a group plan, typically through an employer. So that's what they mean by comprehensive, is everything is included within this one policy. Dental sometimes is included in comprehensive, sometimes it's not. Kind of depends on the employer and what the employer is willing to provide to employees and what the employer is willing to pay for also. But dental insurance clearly covers dental care and some dental injuries. Usually covers 1 to 2 checkups per year, fully covered, typically offered through group insurance, but you can always buy that individually too. Some other types of policies, you can buy accident policies. Just if you have some kind of an accident that's covered, coverage would kick in. Sickness, which is more dread disease, so you could buy a cancer policy, for example. And hospital income policies, which basically guarantee you a certain amount of coverage once you're in the hospital. Um, so just some terminology around health insurance that you need to be aware of. So if you're currently, I'm guessing a lot of you are covered through your parents, or if you're working full-time, you definitely probably have access to insurance potentially. And there's all kinds of terminology around health insurance. Well, deductible just means the initial amount not covered. So for example, with my policy, and I've got group health insurance through USF, there's a $5,000 deductible for the year. It's $2,500 for an individual, and then $5,000 for the family. So once one person hits $2,500, then insurance kicks in, or once the family hits $5,000 of out of pocket, then insurance kicks in. So what that means is the earlier time in the year, I'm paying a lot more out of my pocket for health care until that deductible kicks in, if it even does. This past year, it did not. So you just never really know, of course. If you have a healthy year, you may not ever hit your deductible. And that's okay. It's probably a good thing. So, but deductible is one way. So it's basically part of that move to have people try to become more aware of what insurance costs. So if you're paying a deductible, you're not going to go and get just any healthcare service because it's covered by insurance. You're going to be maybe a little bit smarter shopper and buyer of health services, because you have to pay it out of your pocket up to a certain time period. Participation, which is called coinsurance, this basically means every time you have something done, any kind of service or procedure, you're going to pay a certain dollar amount out of your pocket, and then an amount above that would be covered. So if you just have a doctor visit and you're under a co-insurance policy, there might be a $25 copay. It depends on the type of doctor. It depends on what level of insurance you purchased. There's policies where you pay $50 copay, or if you see a specialist, you pay $75 copay. It all depends on the company, what's covered and what isn't covered. And typically these plans include some kind of a stop loss provision that caps how much your maximum out-of-pocket will be during a particular year. Internal limits are basically just the limits on amount paid on certain items, as usual and customary. So basically what happens is insurance companies negotiate with doctors' offices and clinics and hospitals, saying that they will only pay a certain dollar amount for procedures. So if it's a routine checkup, the insurance company is basically saying, we value that at $150. That's the most we're going to pay on that. So if you bill our insured person more than that, we're not going to cover that anything. We're going to only cover the $150 because that's what we say is usual and customary. And they have all kinds of charges like that based on what the procedure is that's being covered. Coordination of benefits is when somebody is under two policies. So it could be two married people who each have their group insurance, and they cover the other person at each of their places of work. So you've got more than one policy covering you, and so they call that coordination of benefits. So one policy will probably pay more than the other, but both policies may potentially kick in to meet your coverage of whatever the procedure or health service they had done. So terms of coverage is persons in places covered, just basically children covered on parents' plan until they reached age 26. Cancellation just means the policy may be canceled by the company unless there's some kind of a non-cancellation provision within the policy. Pregnancy and abortion policy may limit coverage required for family policy. Maternity and newborn care is one of the essential benefits under the ACA. And then also mental illness is now covered as an essential benefit under the ACA. Rehabilitation coverage is also an essential under the ACA. And then the last one there, the continuation of group coverage under the Consolidated Omnibus Budget Reconciliation Act, called COBRA, which was passed way back in '86. An employer must allow an employee to stay covered for up to 18 months after you leave. So if you are let go or you quit on your own job, the COBRA provision can kick in for 18 months. However, it's very expensive because with most health insurance plans through an employer, the employer is paying for a portion of your premiums. It's really up to the employer how much they pay for. They might be paying for half, 75%, 80%, and you just pay the other part. So for example, if let's just say for a family coverage, let's just say that the insurance company will charge that family, let's just say $1,000 a month to be insured. But the employer is saying, no, we'll cover 75% of that. So the employee is only paying $250 a month. But if you leave your place of business and you want to continue that policy for 18 months, you got to pay it all. So now that full $1,000 is really up to you to pay for now. So that's what they call COBRA. Cost containment provisions, of course, insurance companies are always trying to figure out how to reduce their cost and reduce their risk, and so there's several provisions that they usually put into policies to do that. So for some procedures you have to get authorization ahead of time before, things that are maybe more elective or of course not, emergency services, different story, but for some procedures and coverages you have to get pre-admission, you have to get approval from the insurance company. They will only cover so many nights based on what the illness is or what the surgery is, and so on. So those are all things to check before you have something done. Of course, something that isn't immediately required to be done or something that's maybe more elective, you want to double check that with your insurance company. We also offer long-term care insurance, is basically nursing home care essentially, which is also extremely expensive, just so you know. It's very expensive. Premium if you're older than 65, $2,800 per year with 3-year benefits at 150 days. So even when the benefits kick in, it's only for a certain amount of time. So do you need long-term care insurance? Well, it depends, right? They ask you some questions here that you can take a look at on your own. And then also just some typical provisions for long-term care insurance. I'll just let you guys look at those on your own. You look at the long-term care stuff on your own. The disability one, though, I think is kind of important, especially if you have dependents, if you're the primary wage earner of your family. And even if you're single, disability insurance is not a bad thing. But just kind of think about what happens if you were injured or you're ill enough that you cannot work for a specific amount of time. Disability insurance may kick in. A lot of employers actually will provide this for you. A lot of employers provide short-term disability for free. They just include that, but you can purchase long-term if you would like to, or some combination thereof. But the way to think about it is, if something happens to me where I can't work, therefore I'm not earning a paycheck, how will I get by? And disability insurance will help you get through that. So just some stuff there to think about regarding disability insurance. Okay, so for Chapter 9 homework, obviously there's a quiz like there always is. The Cengage problems, there's 2 particular problems that you'll work on for Cengage. There's 2 worksheets for Chapter 9, and you're going to use this one right here as you do Cengage homework. It's worksheet 9.2. It's about disability benefits needed. So that last stuff we just got done talking about with disability insurance, that worksheet right here, and just some of the terminology right there, that is one of the homework problems. So you use a worksheet like that to help you kind of figure out your coverage and how much disability you may need. So just be looking for that and work on that for your Chapter 9. But just 2 problems for Chapter 9. Hopefully it won't be too bad for you. And if you have questions,